Hello and welcome. In today's episode of Dr. Nora, I take you through what marionette lines are and how they can be treated. First up, what are marionette lines? Well, marionette lines are also known scientifically as mellow mental folds, and these are the lines that sometimes develop as we age from the corners of the mouth down to the jaws, and sometimes they can give you the appearance of looking sad even though you don't feel sad at all. But why would they be called marionette lines? Where did that even come from? Well, interesting fact for you guys is they came from the string puppets, the marionettes. As you can see here, string puppets, when the ventriloquist uses them, they tend to have little lines going from the corners of the mouth down to the chin area, which allows their mouth to move. And those are known as marionette lines. So we've adapted in the medical world to call those bothersome lines the marionette lines. Okay, so we know that they're called marionette lines. We know where that came from, but why do they even appear in the first place? Well, this can happen because of a number of reasons, and they are as follows. The first up is as we get older, we lose the fat pads underneath our skin. Now, when we were younger, we used to have some beautiful fat pads full of volume, which make up the volume of our face. As you can see over here, the face has got plenty of fat pads, which helps to give us projection and volume and that plumpness to our skin. Unfortunately though, as time goes on, we lose our elastin and our collagen, and those fat pads actually start to decrease in size, and so certain areas of the face look more sunken than others, and this can typically happen around the perioral area or the mouth area. Not only do we lose the fat pads around our face, but our skin as a whole also becomes a lot thinner, and that's thanks to the loss of collagen and elastin in the areas. And so when we see our face, sometimes those volume depletions also become more prominent because of our skin loss. Going a little bit deeper than that, we also start to lose our bone as we get older, and this is a process known as bone resorption, whereby the bone becomes a lot thinner, and this is generally seen quite prominently around the mandible, which is the jawline over here, and also in the temples as well, and around the eyes. And so the net impact of that is that these areas look a lot thinner, they look more sunken, and the volume just isn't there as it used to be. Not only do we have all of that to contend with, but we've also got Mother Nature. Now, gravity helps keep us feet flat on the ground, keep us walking nice and straight, but it also has some lay-by effects to the face as well. Now, you can imagine every day as we're going through gravity is pulling everything down. And so you do start to notice that the lower face in particular starts to become more sunken and starts to be more pulled down, and that helps to accentuate those lines, those marionette lines that we have in our lower face. Now, it's not always just Mother Nature, bones and skin. We also have muscles that do also help to accentuate those marionette lines. In the face, we have our depressor anguli oris, which is a tiny little muscle that actually does exactly what it says on the tin. So it depresses the angles of the mouth, so therefore it causes the mouth to drop a little bit. And when this is always activated, the appearance of the corners of the mouth tend to look a little bit sad when maybe you're not feeling so sad. Oh, Dr. No, this all sounds so gloomy. What can I do to help treat this? Well, you may not want to do anything at all, and that is completely acceptable and fine. But for those of you out there who are interested in having something done to the area to help to soften those sad-looking face, then listen up, because here is what we can do as cosmetic practitioners to help treat the marionette lines.
Warning.
Word of warning for you guys, before you go ahead and speak to a cosmetic practitioner about your treatments, please make sure that you go ahead and you speak to an adequately trained healthcare practitioner, because these procedures carry risks, and those risks can be quite significant. So make sure you do your research fully. But once you've gone through that, there are a couple of treatments that we can offer. The first of which is dermal fillers. Now, dermal fillers usually take the part of a non-permanent filler, which is usually hyaluronic acid. Now, we naturally have hyaluronic acid in our skin, but we inject something that is man-made into the skin, and it can help to increase the volume and projection of that area. Depending on your facial structure, you may need a number of mils of filler into the marionette lines, because sometimes if the area is too sunken, you need a lot to replete that volume loss. It is really important that the practitioner you're going to is injecting it into the right area, because what can happen is if you put a mil or 2 mils into the area, you can start to get some shifting of the product, and it may go to areas that are undesirable, causing some cosmetically negative look to your face. And it's so important to make sure that it is injected into the area in the correct plane as well. Now, once you've considered dermal fillers, you may and/or want to consider anti-wrinkle treatment. Now, this is usually done in conjunction with one another, and usually in this situation, we may put some anti-wrinkle treatment into that muscle that we mentioned earlier, the depressor anguli oris, and the impact of that is we're no longer causing it to depress, but causing it to elevate upwards. Of course, anti-wrinkle treatment is not a forever thing, and by no means neither are fillers. They're non-permanent procedures, and certainly anti-wrinkle treatment in this area can be expected to last anywhere from 3 to 5 months, and dermal fillers anywhere from 12 to 18 months, depending on your own individual factors. Some practitioners may have some tricks up their sleeves whereby not only do they inject the filler into the marionette lines followed by the anti-wrinkle treatment, but they may also offer to add some structural support to the oral commissures of the mouth. And this sometimes takes the place of injecting a little bit of filler into each of those oral commissures to help to give your smile a bit of an uplift, but also to add some structural support. Because if you think about it, if you're putting a lot of filler into the lower face, you might actually help to accelerate the gravitational process, and you're really causing a lot of heaviness to this area. However, when you strategically place some filler into the corners of the mouth, it helps to give it some structural support and keep everything nice and uplifted. Of course, your cosmetic practitioner will tell you what's best for yourself after doing a full facial assessment. If you don't like the sound of anti-wrinkle treatments or dermal fillers and you want to go that step further, there are some other treatments out there at the moment, one of which is thread lifting. So threads is where sterile threads are inserted underneath the skin layer, and they help to produce a pulling or a nice tightness of the lower face. And finally, you may want to consider a facelift surgery, which could either be a lower face surgery or full face surgery, but this is an invasive procedure that tends to be permanent in nature. And of course, this should only really be done by a plastic surgeon. So please make sure that you do your research thoroughly and find out what the best thing is for you. Okay, so there you have the treatment options to treat those marionette lines, but what can be done to prevent them in the first place? Well, following on from my previous video of how the skin and the face ages, it is super important to make sure that you guys are on top of your skincare routine. Now, this could be using a moisturizer every day, perhaps that contains a bit of vitamin A, vitamin E, maybe a hyaluronic acid as well in it, and this will help to keep your face feeling moisturized, fresh, and also plumper as time goes on. You may also want to, especially if you're living in Australia, consider using a daily sunblock protection. It is so important because the UV light that we get from the sun every day on a daily basis actually accelerates the aging process. And so by using an SPF at least 30 will help to slow that process down. There are also some factors such as drinking well, drinking lots of water, not drinking any alcohol, trying to keep yourself less stressed, and also exercising thoroughly are super important for your skin health. And of course, if you're a smoker, it might be time just to break that cigarette and kick the habit. So there you have it, guys. That is my quick rundown of what the marionette lines are, how they appear, and how we treat them as cosmetic practitioners. I hope you have found this video useful, and of course, if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. And for now, take care and stay healthy.